Before we start to treat the SI ligaments, the deep six, the gluteus maximus, we always test the hip extension. Of course, when we do a passive test of hip extension, what I'm testing for is not only do they have normal range of motion for this joint, which usually is about 30 to 45 degrees, and do they, the end feel, is it a bone-on-bone end feel, or is it soft and leathery? Now, you prefer soft and leathery. If it's a bone-on-bone, then we would do one of our joint capsule release techniques. I'm going to show you another joint capsule release from the prone position, but before we do that, we always want to loosen up the muscles that are around the joint. So figure 4 is my favorite position because that rolls the head of the femur up, brings all of those attachments to the deep six closer to the surface, and also you can get into the SI ligaments with less discomfort. So we start from the SI ligaments. You're going to place your elbow right in between those little sacral notches and just do your windshield wiper technique. And each notch, wherever you feel those fibrotic notches or fibrotic knots, go all the way down to the end of the sacrum. Once you get near the end, or to the end, you'll run right into the sit bone. Once you reach the sit bone, just move your elbow just a little bit medial, usually only about a half an inch or so, and hook onto the sacrotuberous ligament. Now the sacrotuberous ligament attaches from the sit bone up into the sacrum. So if the sacrum is tilted, this muscle is obviously going to be either shortened and contracted on one side, overstretched on the other. So we want to reduce the tension in that ligament by hooking onto it and then stretching it laterally. When you stretch it laterally, that helps not only reduce the tension in the sacrum, but also allow the pelvis to come back to a more neutral position. And just move right over lateral till your deep six attachments right along that greater trochanteric crest. So if you go right along that crest and friction each one of those tendons of the deep six, you're bound to find some discomfort or trigger points in that area. If it's a sharp pain, it's probably because that sciatic nerve may be inflamed, so you don't want to press directly into it if it's sharp. You always want to pull the muscle away. So you can just use a full-handed petrissage, pulling the muscle away from the nerve, relaxing it, increasing the blood flow in there, and then you can go into the glute maximus, just using some quick compression to energize those muscle spindles, help strengthen up those glutes, which will inevitably help reduce any back or hip pain.